Doctors join us each Thursday, and join us today on the set is Dr. Scott Cooper. Thanks for joining us this morning.
Well, thanks for having me.
You're a podiatrist.
Yes.
It's a little bit difficult word to say, but tell us a little bit, what is a podiatrist?
Well, a podiatrist is a specialist that basically we treat the foot and ankle, and that includes just about everything, anything from skin disorders, nail problems, surgical complications, overuse, injuries.
Right. I imagine now, we don't have a lot of those people in our community, but I imagine you see a lot of skateboarders, especially in your area in Huntington Beach.
Yeah, we do.
A lot of twisted ankles.
Huntington Beach, absolutely, yeah.
Tell us a little bit, what are the health problems that people most commonly come in to see you about?
In a typical day, some of the typical problems that we'll see are, we'll see a lot of nail problems. A lot of people come in with ingrown nails, fungal nails, dermatological problems. I brought in a foot just to kind of give you an idea, you know, how complex the foot is.
Right.
There's 26 bones in the foot and the ankle. And if you look at it, you realize this is a very complex structure. Besides the structure itself, there's multiple ligaments, tendons, and incredible amount of complexity to the foot. So a normal day, we'll see anything from skin conditions, nail conditions. People will come in and just say their feet hurt.
Right.
And sometimes they have no idea why. Other common problems are like deformities, such as bunions, hammer toes. Heel pain is a very, very common problem people will come in with.
I was teasing you a little bit earlier. I said those toes are a little elongated, right? Because for demonstration purposes. You said no, really, the bone of that toe is about that length, huh?
This is a very anatomical foot. Yeah.
If you show that again, that toe is probably what, about 2 inches long, and I think people would be surprised to know that their toes are actually that long.
Yeah, they're pretty long. People have no idea because. The joints actually go quite a bit further back into the foot than people realize.
Yeah. You were mentioning some ailments a little bit earlier. I would imagine you're surprised how long it takes someone to actually get in and see you, where if they're having problems with their toenails and things like that. Nobody wants, they figure it's just going to go away.
Right.
And usually it just gets worse.
Right.
So how do you encourage people out there and patients to just get in there and make sure that it's all working together at some point?
Well, typically, somebody will see their primary physician if they're having a problem. A lot of times, some of the common foot problems, such as heel pain or nail problems, it can be treated at the level of the primary care physician. We usually can get somebody in to see us in podiatry relatively quickly. We strive to get them in within a week or two. If it's something that's an acute problem where there's an infection or it's something more serious, we'll usually get somebody in immediately, which would be within, say 24 hours or 2 days.
When someone has foot pain, say like a heel problem, and they don't get it looked at right away, and then they tend to kind of walk differently, doesn't it affect the hip and the rest of the joints the rest of the way?
Yeah. We'll take heel pain is a great example because heel pain is really common, and it's always kind of amusing because people will come in and say, "You've probably never seen this before." Actually, my mailman said this to me one day, but he said, "But I have a pain in my heel, and it's been 4 months, 5 months." And he said, "I know you've probably never seen this, and I know that you treat feet, but what can I do?" And it's amusing because every day we'll see 4 or 5 people that have heel pain. And there's, unfortunately, by the time somebody comes in, if they let it go for 4 or 5 months, yeah, their knees are sore, their hips sore, they're angry at their cat,
exactly.
All kinds of things. And there's so much that we could do if we start treating that sooner. And that goes for a lot of problems that could be preventable. There's very simple things like wearing good supportive shoes is a start. There's a lot of products that are available over the counter There's arch supports.
Orthotics have come down a lot in price, and they're over the counter now. Do you find that those are helpful, the over the counter orthotics that are out there?
There's a lot of them that we recommend. We try to steer, what we try to do as podiatrists is we try to look at all the products that there are available to consumers right off the shelf. Some products are definitely much more effective than other products that are around. And I'm always kind of looking for what's the best product for whatever the ailment is.
Right. What other recommendations do you have for good foot health? I mean, obviously, a good pair of shoes, which you would think is just common sense, but most people just
you would think that, but what one person thinks is a good pair of shoes and what somebody else thinks, a lot of times it's patient education. Just explaining what makes a good pair of shoes. And actually, especially for women, I think shoes have come a long way. 20 years ago, when I was getting into podiatry, it was actually really difficult to find a good pair of supportive shoes for women that didn't look, didn't look like an army boot. But a lot of the companies that make shoes have become sensitive to that, and there are a lot of very, very good supportive, well-made shoes that are available.
I know the nursing profession actually had a shoe, and then a lot of people started wearing them. They're a little bit more pricey than your average shoe, but boy, it's sure going to make you feel more comfortable, and it's going to help your feet and your good health go a lot longer, obviously.
Absolutely.
And that's usually been. What should someone bring with them if they're going to come and have a consultation with you?
What I like to see is I like to see the shoes that people are wearing. I like to see. I don't want them to come in with a new pair of shoes. I want them to come in with the shoes that they typically wear. And if they're in an occupation, or if they're, say they're a walker or a jogger or whatever they like to do in order to stay active, I like to see those shoes and the shoes that they wear in their occupation most of all. Because for myself, it gives me a good idea of what they're doing wrong and where I can kind of steer them in a direction where they can get more comfort.
Diabetes is very common now in our population, so how do you help people with the diabetic conditions?
Diabetes is a big part of podiatry, and we are part of the diabetic foot team, which includes the vascular surgeons, infectious disease, the endocrinologist, the patient's internist, and we work with that team, and we consider ourselves an integral part of that team. Number one, we want to do preventative treatment. We want to prevent problems. It's much easier to prevent a sore on a foot that might be neuropathic, which is a foot that's lost sensation. And also, we want to assess risk factors. And those would include doing an assessment of circulation, sensation, which is how much feeling does a person have. Someone might come in and think that they can walk around barefoot and their feet feel great, but they might not have a good sensation of what they're stepping on. So we want to, when I first see a diabetic patient, the first thing I want to do is give them within a range, an idea of how healthy their foot is and at how much of a risk they are as far as developing problems. So I want to assess all of that, and a lot of times I can tell them, you are a diabetic, but actually your foot is very healthy, and we don't have to be real concerned, but these are, here's some things you can do to prevent problems.